Hello, my name is Carrie Flynn. I chose the clinical nurse specialist, magnet, and patient safety because I felt like they really went well together. First, we're looking at the what is magnet status. It is given to us by the American Nurses Credentialing Center, and it measures nursing strength and quality. And that's done through a lot of things that we'll go through in the rest of the presentation. There are actually 35 separate criteria. Advanced practice nurses focus on patient safety. It is driven by nurse research and intervention. The CNS uses the 5 components of magnetism to bring about the criteria. One of those is the transformational leadership. That's where clinical nurses are given the power to look into issues that they're having on their floor, to find out what's going on, and to implement change. The structural empowerment is where nurses must find what they need to do, the changes that they must make in protocol. Exemplary professional practice is when nurses with advanced degrees are hired, people hopefully like you and I, so that we can all be on the same page and have the same kind of training, which I can already tell in this first semester that we did not have before. And general knowledge through innovation, and that's where we use studies to implement the evidence-based practices. And improvement through empirical quality and outcomes defines and measures the improvement from the new policies. Certified Nursing Specialist institute change by empowering the nurses to solve problems. They initiate the evidence-based practice that the nurses bring about through their research, and they define, quantify, and implement the changes that the other nurses institute through their research. A lot of CNSs use the Six Sigma method, and that is improvement through reorganization. We're starting to move away from the above leadership and be more about ourselves. We know what needs to be done. We see the issues on the floor. We are the professionals. We know what needs to be done. The CNS manages and implements unit councils that investigate causes and implement solutions. The findings are posted for peer review. At my facility, we often have new boards that are put up to show why policies are being made and what evidence there has been to show to make those policy changes. For example, I've seen falls, CODIs, med errors, wrong site, wrong patient, some of the major issues that we have in healthcare. The process is proven to improve outcomes and increase patient satisfaction, which I think is probably the most important. In increasing patient safety, the numbers were really staggering to me, the difference that the CNS makes on improvement in quality of care. Catheter-associated bloodstream infections, or CABSIs, in one study were found to be reduced by 86%. CODIs, catheter-associated urinary tract infections, were decreased by 47%. Pressure ulcers, 3 and greater, in one study were found to be reduced by 39%. And even though it's a small number, I found it to be very relevant. Especially if it was my family member, the mortality rate from hip fractures was decreased by 0.5%. And we see that a lot in our aging population. Also, the evidence can be shown through cost reduction and through decrease in length of stay. See a group of mothers with high-risk deliveries and babies with low birth weights were given clinical nurse specialist attention, and they had a decrease of 750 days in the hospital, the entire group did, and saved the hospital $2.9 million. Also, the visits and the cost to the patients were reduced, and the patients were happier. A certified nurse specialist group was retained by a corporation, and the corporation found that they had a decrease in health care costs and insurance premium to their employees by the certified nurse specialist advocating wellness, identifying issues such as diabetes, hypertension, etc., and by intervening to advocate for wellness. An acute care floor found that hospital-acquired conditions were reduced by 46% and saved $40,000. CLABSIs on that unit were reduced, saving the unit over $214,000, and 1.4 lives out of the 8 followed in the study. What I'd like to point out that is not exactly in all of these slides is the increase in nurse satisfaction. The research showed also that nurses were happier with their jobs, that they were able to actually intervene in all of these issues that we find in all of our jobs. Nurses really want to do the best for their patients and not just punch in and out of a clock. Patient safety numbers clearly say to the healthcare system that we are ready to be the change that we've been asking for.